Hi there. I've just got together today a little mind map, just listing out some of the different kinds of trays or testing areas that I can assess in a patient when they come for a core scan. I just put this together this morning because some people were asking me some more specific questions about what they can do with the core, or what the core can do for them rather. And so I just thought I'd get a little more specific in the examples which I've laid out here. So I'll just walk through these. So starting up here on the top, we have some of the basic kind of nutritional issues which the core can measure what's going on, and that includes deficiencies, imbalances, as well as some issues with assimilation, which people sometimes have, as well as the big question around dehydration and what the cellular level of hydration or dehydration is at. The next really main area that the core can help with is identifying some really specific remedies. We use homeopathics and we use flower essences, and for example in the homeopathics we use what we call pathic remedies, and those are related to really specific symptom pictures. So if someone has a particular kind of cough or a particular kind of sore throat, or something like specific symptoms related to a bladder infection or something like along those lines. Next group, which we can test on the core, is what we call the chthonic remedies, and those go a little deeper into some of the deep primal fears, which can kind of influence or alter some of the subconscious patterns or behaviors in the patient. We also can test for the different chronic miasms. We do have 8 different chronic miasms, and those are inherited genetic patterns, and they can relate to family health histories around cancer or heart disease or things along those lines. Also, there's a whole area of using homeopathics that relate to specific elements coming from the periodic table, and that's actually quite an interesting area when we get into treating some of the kinds of conflicts people may have within themselves as they're trying to unfold their life or their purpose, or kind of trying to get into their core identity. So that's another interesting assessment we can run through the core. There's also all the specific genotypes and phenotypes. Those are what we call the constitutions or the personality types. As well, we can get into homeopathics around the specific delusions. And again, those which may alter the person's perception of their life and the world around them, and where they may be perceiving things that aren't real, but they are responding to them nonetheless. And we also have an area called the lanthanides. Those kind of go along a little bit with some of the periodic table remedies, but they get more specific into what we call the ego wedge, or some of the conflicts between the false ego and the true self. Now, in addition to the homeopathics, we also have a number of different systems of flower essences programmed into the core trays, and those include the 4 primary ones. That's the Australian bush flower essences, the Bailey flower essences, the Californian flower essences, and the original Bach flower remedies. If anyone knows Rescue Remedy and the work of Dr. Edward Bach, that's what that set is about. Another group of trays that I work with in the core can relate to specific resonance with different art pieces. So whether we have certain films or certain novels, pieces of literature, those have all been programmed in as far as their resonant frequencies, and can be quite illuminating. Actually, I've become more and more interested in using that in my overall assessment of a patient, seeing what some of the bigger themes are that may be running through their life, as far as where they're resonating with that artistically. Also, more specifically into some of the what we call the timeline treatment, we have core trays which indicate to us if there are any shocks or traumas which have not yet been resolved, and those can include physical shocks and traumas, emotional, or shocks to the body related to medical or surgical procedures, as well as dental procedures. Speaking of dental procedures, there is another interesting application of the core scan, when someone is having one of their old fillings replaced, if typically if someone is wanting to get rid of their mercury that's in their mouth, what we can run with the core is find out from their dentist which alternative amalgams that they have available, program all of those into the core, and when we run it for the patient, we could find out which one they're the most compatible with, which is quite an interesting thing to do. And the last example I have here of some of the types of core trays we have are the different either developmental stages or where there's stagnant energy in terms of a person's overall life energy and where they're at in their life. So one of those kinds of trays would be the anthroposophical 7-year stages. That's where we look at the particular development stages, which go from birth to age 7, 7 to 14, 14 to 21, and so on all the way up, and see where there may be some stagnant energy. And that may also correlate with one of the previous trays I showed you with the residual timeline events. So if someone may have had a major shock at a certain time in their life, it may show up in terms of some unprocessed energy related to one of the developmental stages. And last example here in that category relates to the orgonomic segment. So that relates to the specific muscular segmentation in in terms of our torso, mostly in our neck and head. So just kind of like the way an earthworm is segmented, in those bands or segments, the whole musculoskeletal system of the human being also is kind of functioning like an earthworm at a certain level, where we have these bands or segments. So we have the ocular, which goes, of course, across the eyes, and the oral, which is from the nose down to the chin, the cervical, which is the neck, and then we get all through the torso. There's 7 segments in all, and that's another really useful diagnostic tool to understand where the blockage is and what type of treatment the patient will need at that point. So these are just a few examples. I have a number of core trays all programmed in terms of our Heilkunst treatment model, but I just wanted to give you a little bit of an example, a few examples anyways, so you get a bit more of a flavor. So I'll leave that there, but I may put up another video in the next few days or so, which goes into a more specific case study around looking at an actual person's core and what kind of things were coming up in their scan and what that indicated to me for their treatment.